So next one is the chart, the T1 and T2 MRI images appearance of various structures in the brain, and you need to memorize this chart for proper diagnosis. So what should be the color of fat component in T1?
Bright.
Yes, it should be bright. And in case of T2?
T2 also will be bright.
Yeah, both the fat components would be bright both in T1 and T2. And if we compare between T1 and T2, usually this is more bright in case of T1. And what should be CSF in T1?
Dark.
And in case of T2?
White.
Yeah, it should be bright. So the ventricles in case of T1, it will appear as dark, and the ventricle in case of T2, it will appear as bright or hyper intense. And the bones would be dark. Remember, the bones and the blood vessel, both bones and blood vessel, both of them would be dark, both in T1 and T2. So whether this is T1 or T2, the bones and the blood vessel, both of them would be dark. And in case of bone marrow, within the bone marrow, there is some of the fat content. So in T1, it will appear as bright. And in case of T2, this may be bright, but it would be less bright compared to T1. So is this T1 or T2?
T1.
So what should be the color of CSF in T1?
Black.
Yeah,
Black
so the
and hypo.
CSF would be black or hypointense. So within the sulcus, it is black, and also the ventricles. The ventricle containing the CSF, it will also be black. And the fat, the scalp region contains the fat, so it would be bright. And this one is the bone, and this bone will appear black. But within the bone, there may be some of the bone marrow components. These bone marrow components will appear bright in T1. And what should be the color of sinus in T1 and T2?
Dark.
Yeah, in both cases, both in T1 as well as T2, the sinus would be dark or black. And the blood vessel would be black both in T1 as well as T2. So what is the name of this structure? This one?
Ventricle.
Caudate.
Yeah, this is the caudate nucleus. And this one?
Globus.
Yeah, this is the globus villus, and this portion is also known as the putamen. So putamen and caudate nucleus. So what should be the color of caudate nucleus in T1?
Isodense.
Yeah, it can be considered as an isodense. And in case of T2?
More hypodense.
Yeah, it should be more hypodense. So this was our T1 MRI image of the brain. So the fat would be bright, hyperintense or white. Water or CSF would be dark or hypointense. And is it T1 or T2?
T2.
So what should be the color of CSF in T2?
White.
Yeah, it should be white or bright. And this is the main differentiating point. So in T1, the ventricles or CSF, they would be black or dark. And in T2, the ventricles or CSF, they would be bright or hyperintense. And the fat particles within the skull, it will also be bright, but it would be more bright in the T1. And the blood vessels, the veins, arteries, the sinuses, all the three, they would be black or dark both in T1 as well as T2. So the caudate nucleus and putamen, they can much easily be differentiated in case of T1, but it becomes slightly difficult to differentiate them in the T2. So water CSF would be bright, hyperintense, and white in case of T2. So next one is T1 and T2 MRI images appearance in various structures in the spine.